In this video, I'll be discussing the advantages of general practice and why you should, if not already, consider a career as a GP or family medicine doctor. As you may be aware, this channel has a lot of content about general practice, and I have a video discussing the pros and cons to general practice. However, this video is a few years old now, and I thought it would be a good time to do another more updated video, given that there has been a few changes over the years, especially due to the pandemic and the use of technology. I will be discussing 10 advantages of general practice and explaining why you should strongly consider a career as a GP. Hi everyone and welcome back. If you're new, then a massive warm welcome to you. My name is Dr. Baptiste and I currently work as a portfolio GP. Right now I work as a locum GP, mainly remotely, and recently I have returned to seeing patients face to face, which I have missed. I also work at the College of Medicine and Dentistry as a MSc program lead and senior clinical lecturer. I have also been appointed as an associate lecturer at the Open University. As you may know, I'm also the founder of Med School Extra, which is an online educational initiative supporting students like yourself with their medical careers. If you want to know much more about this project, you can sign up at www.medscholextra.co.uk, and we are always looking for new members to help. So some benefits include being a part of a PubMed citable publication, networking, development of leadership and teaching skills, and so much more. If you want to know more about joining the team, then please send an email to info@medscholextra.co.uk, and you can check out this video which tells you much more. As always, please show the channel some support by giving the video a thumbs up if you enjoyed it, and subscribe to stay up to date with new videos. Okay, so let's make a start. This video will be divided into non-clinical and clinical advantages of working as a GP. So let's start with the non-clinical advantages. There are multiple ways of working as a GP. Once you qualify, you can work as a salaried, so an employed GP, a locum, so usually self-employed or as part of a limited company or something called chambers. Or you can be a GP partner, which is also a self-employed GP running a practice. It does not have to be all or nothing, so lots of GPs work as a salaried and a locum GP. If you want to know more about these ways of working, then check out an earlier video. You can work various sessions, so where one session could be 4 hours of clinical work or one clinic, you can work 1 day or 2 sessions, 6 sessions or 3 days. You can spread your sessions across the week, especially if you are a locum GP where you have much more flexibility. You can work as a remote GP, part remote and based at a surgery, so hybrid working, or traditionally based at a GP surgery. I think since the pandemic, there has been a shift to more hybrid working. So you could spend most of your time at a surgery and then have 1 day working from home. Now, this does help many surgeries, especially the larger practices, because sometimes there could be struggles with room space. Working remotely means that you can technically work anywhere. In previous jobs, I have worked with GPs based outside of the UK, so for example in places like Canada. If you want to know much more about how you can work remotely, drop me a message in the comment section below. I also have a video on the advantages of working remotely, which you can check out here. You can work for the NHS and also in the private sector, and as above, you can work remotely for both the NHS and the private sector. Now, if you want to know much more about working in the private sector, then check out an earlier video. This video does go into much more detail. Good earning potential. So as a GP, you do have the capacity to earn a good salary. Now, this is via working in the various ways as mentioned above. Locuming can be quite lucrative and has good flexibility options too. And as you may know, you can earn equal to, if not more than, some hospital consultants, depending on what you do. Now, I don't want you to think that this is easy, because like I have said in many of my previous videos, it's about how much you put into it. You might have to work long hours or deal with medical complexity and a number of other issues. As I've spoken about in a previous video, multiple streams of income, you can take on other roles such as teaching. You can teach medical students, FY2 or foundation year 2 doctors, GP trainees. You could examine medical students as well, GP trainees, or even work for the GMC or General Medical Council as a PLAB examiner, and PLAB stands for Professional and Linguistic Assessments Board exam. You can also work in another role. You can become an appraiser, which involves meeting with other GPs and assessing their scope of work and how they have been managing over the previous year, and if they are still fit to practice. Other roles include working as a program director, which would enable you to earn roughly 80 to 90k per annum. So if you are working 2 sessions or 1 day, then this might work out to be around 16 to 18k per annum, depending on the hours as above. Working for the CCG. You can also work for the CCG, and in the Business of General Practice video, I do talk about that. And there are other organisations and companies that you could of course work for. Opportunities. So let's face it, as nice as it is to complete medical school and call yourself a doctor, the journey is just beginning. And when you embark on a training program and finally complete your training, you ultimately become more credible. You've made it essentially, and you earn much more respect, as you probably know, compared to a junior. So with this comes more opportunities to better your career and earn even more credibility within and outside of medicine. An example would include speaking opportunities for companies, organisations, or even the media, magazines, newspapers, and TV. Of course, there are many doctors out there who are very credible and haven't completed their training or who aren't on a training pathway. Work-life balance. So one of the big advantages of choosing general practice is the ability to have a better work-life balance relative to working in the hospital. So yes, you may have to work long days, but there are no on-calls such as a string of nights or weekend shifts unless you actually want to. You can find out more about a typical day as a GP in an earlier video. If you do, you can work in an urgent care centre or out-of-hours care. If you prefer working nights, you can just do that too. I have a video about out-of-hours care if you do want to know more. Some GPs might work in the out of hours for a few days out of the week and have the remaining days for family commitments, hobbies, or even other jobs that might be more creative. Now, if you want to know how you might be able to balance everything when you start working, or if you are working and struggling to find a good work-life balance, then check out an earlier video. Career prospects. So as I have discussed in previous videos, there are excellent career prospects. General practice can act as a foundation for other careers such as palliative medicine and occupational medicine. You can also work as a functional medical assessor. You can actually do this from F2 level. You can become a GP with an extended role or a GP with a specialist interest and work as a sports club doctor as an example. Now, if you want to know how you can do this, then you should watch an earlier video with a sports medicine doctor. You can also set up your own private practice as a GP. Now let's talk about the clinical advantages. The use of technology compared to some hospitals. One big advantage of working in general practice is the use of technology compared to working in some hospitals across the country. I used to get so frustrated, which I'm sure many of you can relate to, working in the hospital because the NHS was so behind in terms of its use of technology. The first time I used a fax machine was when I started working in the NHS. Now, whilst things have improved, there is still a long way to go, even for general practice. But on the whole, all medical records and prescribing is electronic. I have spoken about electronic prescribing in an earlier video. Patient notes can be accessed by other departments or organisations who need information such as the rapid response or mental health teams. This really helps coordinate care effectively. General practice also uses apps and integrated systems such as econsult, which helps triage patients, so patients can be prioritised according to need. Multiple specialties. Can't seem to find just one that's right for you? The benefits of choosing general practice is that you don't have to choose one specialty, which I know can be hard to do, especially as early on as a foundation doctor. If you haven't found that one specialty that you are really interested in, just them all perhaps, then you should seriously consider general practice. General practice allows you to be a well-rounded doctor, learning and becoming proficient in multiple specialties. One might argue that it is better to know about many specialties than just one specialty really well. As you know, you can learn much more about a specialty by becoming a GP with an extended role or GP with a specialist interest and undertake a diploma. You can also complete other courses and postgraduate degrees in areas such as sports medicine, for example. In one clinic, I could manage patients presenting with mental health issues, skin complaints, oncology, and end-of-life care symptom control, patients with an exacerbation of COPD or heart failure. So whilst I may not be a specialist, I am able to manage patients across a variety of specialties reasonably well. Continuity of care. So as a GP, despite what many might say, there is still lots of opportunity to continue to care for the same patients and get to know patients well. Even as a locum GP, you may encounter the same patients again and get to know them. Sometimes patients will request to see you and book in only with you. Sometimes you can book patients in for follow-up appointments with yourself. Of course, if a colleague is not there, then you may happen to see that patient again. So as much as things have changed a lot over the years, with the traditional way GPs used to work, there is still a chance to really get to know your patients, which is something that drew me to general practice. Lots of support contrary to popular belief. You might think that as a GP you can be isolated, and that might be true in some cases. But if you are great at working independently, then general practice might be for you. As much as you consult patients alone, you generally have someone around who can help, and that might be your fellow GPs in the practice or other members of the MDT, such as pharmacists or nurse practitioners. You can also contact the registrar and consultants at the local hospitals via phone or via a service called advice and guidance. So this is where you can email a specialist who will be able to provide you with some advice about a patient and decide whether they need to be seen as a referral to secondary care or not. I've always found this service really helpful for both myself and my patients. You also have to remember that in the hospital, you are also practicing independently, clerking patients, speaking to relatives, and when you are on call with a skeleton team, there can be less people to ask for help. There are of course pros and cons to everything. Access to investigations, just like the hospital physicians. Although there can be issues that also occur in the hospital, there is access to blood tests, including some specialist blood tests, as well as imaging like CT, ultrasound and MRIs. This can also be prioritised based on urgency. Sometimes it might be better to refer the patient to, say, a service like musculoskeletal, for example, because they can request investigations there if needed. This is good because the patient is then already under the care of those specialists, rather than booking the scan in general practice, then having the scan result returned to the GP, and then for a referral to be made if something is abnormal. It might save time for the patient and prevent worsening of their condition in some cases. If someone is unwell enough to need bloods or imaging straight away, then they should be referred to the hospital. Ambulatory care is a really good service where some patients who do not need to go to A&E can be seen and then in some cases brought back for follow-up investigations. So there are lots of benefits to choosing general practice, and if you haven't considered a career in general practice, then you might want to start thinking about it now. You should always be open-minded and keep your options open because you do not know what the future holds. I really hope that helps, and as always, if you found this video useful, then be sure to give it a thumbs up and subscribe to the channel for more of the same. I will see you in the next video.